can see me now. I've got no cream on my hands. Katie's got no cream on her body either. So we're looking at platysma. So we're coming all the way down to the clavicle. So thinking about our anatomy. So this is where our anatomy is important. Coming all the way down to the clavicle, all the way up to the submandibular area into the face, because the platysma is going to interdigitate up through the face. And you can see I'm really winding up the tissue. And then that last little moment there, I was probably really getting into her scalene area as well. So you can combine your scalenes here. You can see I've gone straight into coming in through her pec major and subclavis area. So we think about from a breathing perspective, rounded shoulders, we want to open people up so we can come in and really do some really nice fascial release. And you can go a little bit more slowly than what I'm doing here. You can be quite direct in terms of using your whole finger, the pads of your finger, coming right up under that clavicle to release through here. And then you want to bring that back into your platysma. So you can see I'm going to come straight in back into my platysma through the side and capture some of those scalenes. So I'm really sweeping through the treatment. Now, this is a nice treatment because it's not going to be painful, hopefully. And if it is painful, that gives you a really good sign how much this person's going to tolerate or how little they're going to tolerate, isn't it?
Absolutely. I think to help with some of that pressure pain, because, you know, if you've got tightness and trigger points in muscles and things like that, if you're doing gentle sweeping techniques, they can be quite painful. So having really broad contact, you probably noticed Annie wasn't using the tips and the tops of her fingers. She was using her whole finger and then the pad depending on the region of the neck and the shoulder region as well. So lots of broad contact to give
and
you
always
equal
following
pressure. Yeah, and it's a continuous movement as well. So you've always got at least one hand on the patient at any one time, just so that, so it feels nice, really, and relaxes.
And one of the things I've noticed with the people who come on our courses, that often it is the more direct pressure. So we're not used to using our whole hand. If if you haven't learned from a myofascial paradigm, or depending on where your training is, often we're not thinking about what we're doing with our whole hand. And I think that's a really useful thing to actually just start playing around with in the clinic. On any part of the body, it doesn't have to be up through the head and the neck, but this is a really nice way just to down-regulate. So really just helps people go, okay, that felt nice, all right, and they become a little bit more engaged. The other thing people ask us is, should I talk? Should I be quiet? And I just let it flow.
Yeah, absolutely. And the patient is allowed to talk as well, because they're often asking, is it going to ruin it if I start speaking? If it helps them relax and they're happier, they're absolutely allowed to talk, but they don't have to if they don't want to either. I think the other thing that you touched on is people can feel your tension in your arms 100%. And in your body on their body, regardless of the region you're working on. So if you want someone to relax, you need to relax, and the more relaxed you are, the more relaxed the patient will feel, the nicer the touch will feel, and everything will just work.
Yeah, absolutely. And I think if you're feeling, if you've got the tension in your hands here and you've got the tension in your body, because it's so vulnerable, this area, they just feel it.
Yeah, absolutely. So just cool, calm, collected.
Yeah. And so in terms of that, I talk about me being a bit of a lazy physio because I like to sit down when I'm doing these things at the top of the bed, because I can sit down, I can put my arms on the pillows, I can just feel really relaxed in my body, so I'm not putting my own tension in there. Some people prefer to stand up.
I prefer to stand.
Kat prefers to stand, which is fine. And so it's just that the main thing is, how relaxed is your body?
Exactly.
And are you absorbing that person's tension through your body? You're just taking it away. You're not winding it up, essentially.
Exactly.
All right, so let's have a look at our glossus group. So our glossus group and our suprahyo group and our digastric, I have grouped these together for this masterclass because I think we don't have x-ray vision. We've got a really good idea about how we can palpate it and differentiate. But when we're treating, often we are bringing them broad brushed in together. And just to remind people, our suprahyoid area is the area above the hyoid, so it is going to involve our posterior digastric, our anterior digastric, our mylohyoid muscle, our muscles that are going to be inserting into our tongue, so our glossus group. So I've just grouped it together as the suprahyoids. Now, this is going to come in and interdigitate into what we do with platysma, really, isn't it? So let's have a little look.
Will.
So we can see, so I'm coming up through that platysma, and then you can see I'm following the mandibular border, and I'm really trying to use the phalanx, like the whole length of my finger, and I'm following along. So my second hand that has more digits is really quite relaxed. So I'll be doing something a little bit more focused with the length of my phalanx, and then I'm going to sweep through. I talk about sweeping through with the other digits so that it feels nice and soft and less direct. I feel people can relax a little bit more when they do that.
People who are new to this sometimes will just use their fingers and their wrists and hands. And if you watch Annie's left arm, so the one towards the top back of the screen, you can see and appreciate that her elbow is driving the movement, and she's actually getting a lot of movement from her shoulder as well. So that's going to help broaden the pressure and make it less pokey and less yucky for people as well.
Yeah, and importantly, you're looking after your hands and your wrists.
So
your fingers and wrists.
And a clinician.
and with this area, because it's so small, when you start palpating and you're using your fingers more, sometimes your fingers, like your lumbricals and your fingers, you're like, I'd be doing a bit of this exercise. You can start being like, oh yeah, I'm really starting to use this area. So don't be worried about a little bit of DOMS in your hands. That's probably pretty normal. But one of the things, we don't want to be having too much of that in the wrist. Okay, so everything is really nice and in straight line, essentially.
Yeah. And you definitely don't want to be in pain in your wrist and hand while you're doing the techniques.
No.
That's incorrect. Yeah,
absolutely. All right, and we're going to finish off with this treatment technique of SCM. So sternocleidomastoid, for most physios, we're going to be treating it, I'd hope so, with our cervical spine and our neck issues. But because it does light the front, sometimes we do forget about it. So what we've just popped in here is one of the techniques where we are doing the proximal third. So if we think about our sternocleidomastoid and breaking it down into its proximal middle and our distal third, remembering the distal third has another head going to the clavicular head. All right, but we're going to look at that proximal area. Now, the thing about doing the sternocleidomastoid that I quite like in this laryngeal area is with your supporting hand, you can provide a little bit of pressure, a little bit of upper cervical flexion. You can control the movement. The person can feel really supported in your, their head in your hand really. And then you can drive what you're doing with your working hand into the belly of the SCM through the top. The other thing that I'll mention before we play the video is to actually make sure you're releasing right up through the mastoid process and all the way back. So our sternocleidomastoid is going to insert all the way back up through our head and our neck area. So making sure we're not just stopping short here, that we're coming all the way up and around. Yeah. So what it looks like, you can see that I've just given Katie a little bit of an upper cervical flexion, a little bit of traction there, and then I'm coming through. So I'm making sure I'm on the belly, and then I'm sweeping up. So I'm coming down on the belly and then I'm sweeping up, and you can see I'm curling my fingers around. And where I'm curling my fingers around on the way up, when I'm sweeping up, I'm coming up and around all the way up through the mastoid, and I'm giving a little bit of pressure and tension up through there. So that's really fascial, that technique. So I don't have too much cream on my fingers. I use the smallest amount of cream, and it lasts. I've got a bottle that lasts forever.
Yeah,
I mean,
they do seem to last forever, don't
we,
they?
We really don't go through much cream because we're using the natural oils as well. And people don't want to have a lot of oil in their hair or on their skin or on their face and their neck. You don't want to be using a heavy cream, and don't be using something that's got a lot of perfumes. All right, this patient population is this. People who are coming in, they are often really irritable in their larynx. So if something's really smelly, they're clearing their throat. It can create it can actually flare them up. Yeah.
I think also because of the suppleness of the skin in this region, and also the visibility of it, if someone hasn't used the cream before and it's got lots of ingredients, there's a higher risk of a contact dermatitis or something like that, and an allergy in the area. You don't want that walking around on the front of your neck. So just low allergen creams.
Absolutely. Thanks, Kat. All right, so looking at our posture, so laryngeal postural setup. So this is also lumbopelvic postural setup. Now, I love this because I like saving time, and I think this is really amazing. We can think about correcting through that lumbopelvic area, and we're doing that anterior, posterior pelvic tilt, finding that neutral pelvis. When we do that, Gwen Gel's work has indicated that we can activate those deep neck stabilizers without us even thinking about it, which is terrific. So if we can activate our deep neck stabilizers, we can actually then set ourselves up posturally really quite well. Yeah. So looking at Katie, we're just correcting Katie coming up, and the cue I'm actually using for Katie through the front is nose to chin or a heavy chin, rather than bring your chin back for a double chin, okay? So we're really looking at nose to chin from a postural setup.